Hi, it's Dr. Janowski for Sonata. Today we're going to do a mint thread lift, and mint is the brand name. The type of thread is called a PDO thread or a polydioxanone thread. It's an absorbable barb suture that's really great for non-surgical facelifting. So if you want to lift skin on the face, you got two options. You got surgical facelift or non-surgical facelift. So a lot of people are trying to avoid the surgical one. So it's not for everybody. It's not for necessarily older clients, but people in their 30s, 40s, 50s are probably great candidates for a non-surgical thread lift. So we are placing or injecting these threads, as I will show you, to cause lift temporarily, so it can last up to a year. Just like a filler, it will absorb and go away, and then it can be repeated. And the way we do it here with mint thread lifts, which is my preferred product, is that we numb up the patient really, really well. They don't feel the procedure at all. There's a little bit of soreness and some swelling afterwards, so you have to prepare for that. But the procedure actually is quite easy for the patient, and then we get nice instant lifting effect, and it will last a number of months and then can be repeated, as I said, usually to about a year. So what I'm going to do now is I'm just going to mark up the patient of where I want to put them. There's many different patterns and ways you can do it. And we're going to do some lifting in the mid-face here. We're going to lift up into the jowl, and we'll do a little bit in the neck. So there'll be kind of three areas that we're gonna work on all at the same time here. And I'm just marking my entry points and my termination points of the different zones that we're going to do. Alright, we'll do some of this. So now we're going to numb up the entire area that we're treating so that there's no sensation at all. And we've already numbed these little entry points here, so we're just going to go ahead and we're going to push the numbing medicine down. You doing okay with that?
Mm-hmm.
Yeah. So generally people don't really feel much of this, although it looks a little bit strange. We just want to get that numbing underneath the skin, right in the area we're going to be in, so nobody's going to feel anything. So we're going to go and do that. And then we'll do some over here as well. So we've almost finished the numbing process, and once that's done, really the patient's not going to feel a thing. It's really quite painless, and the numbing so far has been easy.
Yes.
Yeah. And so that's the only part anyone's going to feel. So she's all done with the numbing, and then we'll proceed to the procedure. So now we're going to start the procedure itself. Creating some tiny little entry points here through which we can put our cannula, and the cannula is what delivers the thread. And so this is our cannula here, and the patient won't feel anything. And first we'll put our cannula in, and then we'll put the thread through it. So what we do is we simply use our cannula to go just under the skin into the subcutaneous plane, and the patient may feel hear some funny sounds, but shouldn't hurt. And so we'll place our cannula where we want it, and then we'll take our thread and we'll put that inside the cannula, and then remove the cannula. Now the thread is in place, it's not going anywhere, and I do two at a time, and then I tie two together, and that gives us our lift. So what we'll do is put a second one in, like this, and then we'll do a little twisting, feel where the cannula tip is going, and then get it to our destination there. And then that's two, so we do everything in pairs. Thread this. This is a mint 17 centimeters is what the length of the thread is. And so we've got two that we'll tie, and you'll see the instant lift here. Oh, there it goes. It's lifting up. And then we'll tie a second time. And then we'll cut the ends. Doing good. Okay, thumbs up. Any discomfort at all?
Not at all.
Okay, great. And then we'll go ahead and pop them in. Now they're down, the knot is down underneath the skin, and that is one set right there. Excellent. Okay, so we just did the jowl. Now we're going to work on the nasolabial area and the cheek here and get that to move up. And these entry points are very hard to see or find when they're done. They close up perfectly. It's right in the hairline there. So that's one thing I like about this as opposed to a product like Silhouette where you have the entry point in the middle. You really don't see anything afterwards. Good. We're going to stay superficial here so we can get a good pull here. Let me just make sure we good. All right. Let's put another thread in here. So we've used 4 so far, but now we're going to do 2 more here in this area. Good, that's 5, and then we'll put one more right here. Okay. And the nice thing about the mint is you can go back and forth till you get it just where you want it without committing to where the thread's going to be. That's what the cannula is for, and then once you've got it where you want it, then the thread goes in, so you don't just get a one-shot deal like you do with products like Nova threads. Alright, so that's 5 and 6, and again we'll see a nice lift there. Good. Awesome. I like to tie them real tight and get a good strong pull out of it because the threads will relax a little bit over time. Alright, so that's those guys. Those are all in there. Now we're gonna split between below the jaw and above the jaw to try to tighten that jawline in a little bit in the neck. So again, we're going to use our cannula first and stay superficial in the subcutaneous layer here. A little pokey for a second. Okay, good. Poke. Okay, good. That one's in. And we'll do that one. And then one more on this side and that'll be done. Alright, and so we'll go ahead and we'll aim it up towards above the jawline here. I like to twist the cannula if I'm getting resistance. It helps to move it forward. A little tiny poke right here, real fast. Okay. Good. All right. Good, and we'll tie our last 2 together here, and we'll see an improvement there in the neck. We saw that right there. Alright. Good. And then we'll cut these 2, and that'll be it for this side. Cut right at the knot, right over the knot there. A little bit of tethering there is okay. That will go away. I'm just going to push on that. All right. Okay. Okay, so we finished our mint procedure. As you can see, the patient is going to look puffy because of all that fluid. We put 20 cc's of numbing fluid on each side of the face. So 40 cc's of fluid, you're going to see that. Your body will absorb that within a few days and that'll disappear. But what we can see nicely already is that nice straight jawline. That's where we see that nice lift that's already occurring and improvement here, and that she's going to keep. So we typically will see patients back in a week and everyone's looking pretty much healed by then. And then they can enjoy the results until it starts to wear off at close to a year. So that's the mint procedure. Mint thread lifting, my preferred product for thread lifting. And if it's something you're interested in, let me know.